Welcome to the Barcode Medication Administration, also referred to as BCMA, web-based training for clinical staff. This training program addresses nursing and pharmacy processes and issues and the necessary collaborative effort involved to effectively and safely use the BCMA software application. The target audience for this training includes BCMA coordinators, pharmacy coordinators, inpatient pharmacy supervisors, nursing education staff, clinical nurses responsible for training, and the nurses, respiratory therapists, and/or other clinicians that administer medications. BCMA software is an innovative automated system that uses wireless point-of-care technology with an integrated barcode scanner to record the administration of patient medications. When used as intended, BCMA can dramatically reduce medication administration errors by letting nurses perform the following functions: electronically verify a patient's identity, validate the patient's medications against their active orders from the pharmacy, record the patient's medication information once administered. Each time a nurse scans the barcode on an ordered medication, BCMA ensures that a patient receives their medication in the correct dosage, on time, as well as electronically documents the medication status and route. The system of checks and balances that BCMA provides visually reminds nurses when medications need to be administered and when they need to assess the effectiveness of doses scheduled for administration. No longer must they rely solely on their short-term memory. Goals and objectives. The overall goal of this training is to present critical BCMA functionality and process information to nursing and pharmacy staff. The intent is to provide the knowledge and skills required to effectively use the BCMA application to enhance medication administration and delivery, and to increase safety by reducing medication errors. At the conclusion of this training, the participant will be able to access the BCMA GUI software and execute the available actions, administer medications by using the virtual do list, also referred to as the VDL, edit medication entries via the VDL, enter PRN effectiveness via the VDL, identify available tools for training and implementation to be utilized at their respective site, and troubleshoot medication administration process discrepancies. For the purpose of this training and the VA's privacy policy, all information presented here uses a test account populated with fictitious patient data. In addition, there may be local site variations including, but not limited to, desktop configurations, log-on screens, parameters, etc. As you use the BCMA program, please remember that this is one piece of the Veterans Health Record. As such, it is a legal document. Whenever you enter comments or add free text information, it should be clinically appropriate to the medication event and as concise as possible to convey the information. To begin, click on a module tab and press the Start Module button. To directly access a particular topic, select the subtopic and press the Start Module button. Accessing the BCMA application. To access BCMA, double-click the BCMA icon on the computer desktop. The BCMA application should open to the dialog window that allows the entry of your access and verify codes. Signing in to BCMA. When the Sign In dialog window appears, the user enters their access and verify codes into the corresponding fields. Clicking the OK button or using the Enter key on the keyboard will open the application. If you are prompted to select a division to continue sign-in, please do so and click OK. The application will open to the Scan Patient Wristband dialog window. For training purposes and to demonstrate the menu bar and toolbar, we will click Cancel. The menu bar. There are 6 options on the menu bar: File, View, Reports, Do List, Tools, and Help. The File option contains the following selections: Open Patient Record, Open in Limited Access, Open in Read Only, Close Patient Record, Edit Medlog, and Exit. The View option contains the following selections: Med tab, Icon Legends, Allergies, Patient Demographics, and Flag. The Reports option allows the user to view and print reports. There are many different reports under this option, and some will be discussed later in this training. Some of the most frequently used reports are missed medications, PRN effectiveness, and due list. The due list menu selections may be grayed out until a medication is administered. Many of the selections found under this menu will become available once you begin the actual medication administration process. The Tools menu is configurable by your local facility. It may display several helpful links. The Help menu contains the following selections: Content, Index, and About BCMA. The toolbar, located at the top of the VDL, provides options for accessing features in BCMA. They include missing dose, medication log, medication administration history, allergies, CPRS, med order, and flag. Several of these features can also be accessed from the menu bar. Levels of BCMA access: full, limited, and read-only. Clicking on File will allow you to select different levels of access. Full access provides the user complete access to administer a medication. Please note the title bar does not display the phrase full access, but it will not have either limited access or read-only displayed. Limited access allows the user to perform all actions except administer a medication and take action on an IV. It allows a user to open a patient's record to perform limited functions such as generating patient-specific reports, marking medications as held, such as when a patient is off the unit, refused if the patient does not want to take the medications, documenting PRN effectiveness, or submitting a missing dose request without having to scan the patient's wristband. Read-only is a feature used by individuals that need to view medication administration information. It is especially helpful for providers, pharmacists, and students. This mode does not permit any actions to be taken in BCMA. Ward reports access. The user can also access ward reports without scanning the patient's wristband. Clicking on the Reports menu will reveal a drop-down list of the reports that are available for viewing or printing. For instance, the user could print a medication due list for their patient to assist planning for the shift's medication administration. Opening a patient record. You are now ready to access the patient record. Click on File and then click Open Patient Record. Now let's make sure the barcode scanner is ready. The Scan Patient Wristband dialog window displays a current scanner status as ready or green, or not ready, indicated by red. Enable Scanner, Unable to Scan, and Cancel options are also available choices in this window. If the scanner is not ready or red, you will need to enable the scanner by clicking on the Enable Scanner. Scanning a patient wristband. Hold the scanner about 6 to 8 inches from the barcode on the wristband. Press the scanner trigger and direct the scanner beam over the wristband barcode. This electronically identifies the patient. It is critical that a second identifier, such as asking the patient their name and full Social Security number, should also be used in addition to scanning the wristband to increase patient safety. New employees should review their local policy on patient identification for additional information. After scanning the patient's wristband, you will see the patient confirmation window. If the patient wristband does not scan for any reason, follow your site's policy for addressing this situation. You should obtain a new wristband and place on the patient, removing the old one. In urgent situations, you may still proceed with your medication administration utilizing the Unable to Scan option. If the wristband barcode does not scan after 2 to 3 attempts, click on the Unable to Scan button. The Unable to Scan window will display. The user must select a reason from the list, for example, damaged wristband.
A box is available for optional comments by the user if needed. This information is tracked on a monthly National Managing Scanning Failures report and evaluated for trends by the facility BCMA coordinator and the Barcode Resource Office for process improvement purposes. Click on OK to continue. The next window, Patient Select, allows the user to enter an initial and last four, for example, B2011, a full Social Security number, or to select from a ward list, for example, 7N or 7 North. When the correct patient is selected, click OK. This will then bring up the patient confirmation window. The patient confirmation dialog window allows the user to confirm the correct patient's wristband has been scanned. It also allows the user to check the list of allergies and adverse drug reactions. Additional information may also be displayed on the patient confirmation screens, such as sensitive record and other patient record flags. In the case of a sensitive patient record, you will receive a warning screen. The warning screen allows you to continue and open the patient's record if you are officially involved in the patient's care, or to cancel and not open the record. In the event a wristband does not scan, this is the patient confirmation window that will display when the user has performed the unable to scan function for wristbands. Note that the user is required to confirm that she or he has accurately identified the patient using 2 acceptable identifiers. After viewing this screen and confirming that this is the correct patient, click the Yes button or type Y on the keyboard. This opens the patient's record to the BCMA screen, or what is referred to as the Virtual Do List, or VDL. The Virtual Do List. This is the initial screen that users will see after opening a patient's BCMA record. Each of the sections on the VDL display screen will be discussed as this training continues. When a patient record opens, the Barcode Medication Administration screen always defaults to the Unit Dose tab on the Virtual Do List. There are 3 other tabs, Cover Sheet, IV Push, IV Piggyback, and IV, that will be demonstrated later in other sections of this training. Patient Demographics. The top left of the VDL displays the patient's demographic area. This area displays the patient name, Social Security number, date of birth, height and weight, and the ward location. Clicking in this area will bring up the Patient Demographics window, which displays detailed patient inquiry information. This information is the same as that found in CPRS. The Virtual Do List Parameters area on the Unit Dose tab is displayed on the screen as shown here. In this case, the VDL time parameters are set to show a 2-hour period of time based on when the user logs in. If you wish to view medications due outside this 2-hour window, you can modify the time parameters by hourly increments to view a different time period. The parameters allow you to set the time back a maximum of 12 hours and forward a maximum of 12 hours. In the case of medication orders that have a schedule type of continuous, the medication orders will display on the VDL based on the start and stop time selected. The Virtual Do List displays active medications that are due for the patient during the time parameters selected by the user. Active one-time, on-call, and PRN orders that do not have a specific time associated with them will appear on the VDL regardless of the selected time parameters. When a user sets their own time parameters for one patient, those times will remain the same for all other patients during the time that the user has BCMA open. When BCMA is closed and then reopened, the default time parameters will display. Users should take extreme caution when selecting time parameters that are beyond their facility's policies, as this may increase the possibility of medication errors. The Schedule Types checkboxes are located in the upper right corner of the Unit Dose tab. All medications with the designated schedule types checked will display on the Virtual Do List for the user to review. If the patient has active orders with a specific schedule type, that schedule type will have a bright green circle next to it as an alert to the user. If there are no active medications of a specific schedule type, the circle next to that schedule type will be white. Once the virtual do list display has been reviewed, the user can customize the view to display only a specific schedule type. To customize the view, place the cursor arrow over the check mark and click to uncheck the schedule type. Unchecking the PRN schedule type will cause the PRN medications to no longer display on the VDL. In order to administer a PRN medication, it must display on the VDL. Checking the PRN schedule type will allow the PRN medications to again display on the VDL. If a user has changed the schedule types to display when she or he closes the patient record to scan a new patient wristband, the schedule types are reset to the local default settings for schedule types. Allergies and adverse drug reactions will display in the red text as seen in the screen shown here. For more detailed allergy information, the user may select the Allergies button located on the second menu bar, or select Allergies from the View drop-down menu on the first menu bar. Columns can be resized as needed by placing the mouse pointer at the edge of a column header. When the double-sided arrow appears, left-click, hold, and drag the mouse pointer to the right or left until all of the information is displayed. The virtual do list columns. The status column displays the status for the current administration. Available statuses for the unit dose tab include G for given, H for held, R for refused, RM for removed, and M for missing dose. A blank box indicates no action has been taken during the specified time parameter. The column heading VER represents the nurse verification column. The column will display the 3 stars if the medication order has not been verified by a nurse in CPRS. Orders cannot be verified in BCMA. The type column displays the schedule type for each corresponding order within the display area. The following abbreviations display within this column: C for continuous, P for PRN, O for one-time, and OC for on-call. The active medication column displays first the specific name of the medication. Below the medication name is the form and dose in which it is dispensed. For example, acetaminophen tab is the name of the medication, and acetaminophen 325 mg tab is the form in which it is dispensed. This may not always be the dosage that is to be given, as seen in the next column. The dosage column displays the actual dose to be administered. This may be more or less than the dose of the medication shown in the active medication column. This situation will be demonstrated later in the training. It also displays the ordered frequency of the medication, such as Q6 hours or BID. The route column displays the medication administration route for each order. The admin time column displays the administration time for each order. PRN, on-call, and one-time schedule types do not have administration times. This field will be blank. The last action column displays the status and the date and time of the last action on any order for the same medication, regardless of schedule type. An example would be when a patient has orders for a continuous medication such as albuterol 2.5 mg at 3 ml every 6 hours, and a separate order for the same medication every 3 hours PRN. The last time an action, such as given, was taken on either the continuous or the PRN order, this information will display in the last action column for both on the VDL. The last site column displays the last injection site for an injectable medication. There will be more demonstration of this later in the training. We concluded Module 1 with an overview of the cover sheet. We will now turn our attention back to the virtual do list to describe and demonstrate the processes for administering medications. Click on the Unit Dose tab to begin. Medications may only be administered or scanned in the full access mode.
Verify that you are in full access by viewing the top title bar of the BCMA screen. It should not display limited access or read only. If it displays either of these, click on File in the upper left corner and select Open Patient Record. You will then be prompted to scan the patient's wristband as noted in Module 1. When the VDL opens, you are ready to administer medications. The scanner status is located in the lower left section of the VDL. In order to scan a medication, the scanner status light must be green and the display above it will display Ready. If the scanner status light is red, the display will show Not Ready. To change the scanner status to green, click on the Enable Scanner button. The scanner status becomes green and is now ready for scanning medications. In limited access and read-only modes, the scanner status will always be red or Not Ready. Scanning a medication. To properly scan the medication, hold the barcode scanner approximately 8 inches from the barcode on the package or vial, press the scanner trigger, and direct the scanner beam over the medication barcode. The scanner may beep to indicate when it has read the barcode. In some cases, BCMA may present a dialog window requiring more information to complete the documentation. We will discuss that in more detail in the next section. You will need to verify on the VDL screen that the medication has been displayed as given by the presence of a G in the status column on the left side of the screen. The G indicates that all system checks concur to administer the medication to the patient. The status of G for given is recorded in the medication log and medication administration history. Quantity and units. Many medications require the user to enter a quantity in units to be documented in BCMA. These would include anything in a multi-dose form such as a liquid, for example, insulin, nebulizers, eye drops, creams, and lotions. An example of this will be demonstrated later in the module. Multiple dose. Occasionally, a medication order may require the user to administer more than one tablet or capsule to complete the dose. In this case, each tablet or capsule will need to be scanned individually to complete the administration. In some instances, medications are provided by the pharmacy in a unit dose greater than the dose ordered by the provider. This creates the need to split a tablet. In BCMA, these are called fractional doses. When the barcode on the unit dose package is scanned, BCMA will prompt the user with the fractional dose dialog window as a safety precaution to remind the user of the need to split a tablet as demonstrated here. Right-click options. There are several options available to the user by clicking the right mouse button. Add a comment. Right-click on the medication order and choose Add Comment. A box will appear where you may enter your comment. Clicking OK stores your comment in the BCMA Medication Administration Log. You cannot add a comment for a medication for which an action has not been taken. Once a comment has been entered, that comment cannot be edited. Display order. In some cases, you might wish to see further information about an order. For example, if the Verify column shows yellow highlighting, hovering over that highlighted area will show you that there are override or intervention reasons. Right-clicking on the medication allows you to choose the Display Order option. Once the order displays, you can review the provider critical drug-drug interaction overrides or allergy/ADR overrides, as well as pharmacy interventions. Special instructions and other print info. Right-clicking on a medication with special instructions in red, then clicking on Special Instructions/Other Print Info will display those instructions in a new dialog window. In some cases, there is a need to cancel or undo an administration. Only use Undo Given if the status of given displays in the status column. In this example, we have scanned the ascorbic acid. After scanning the medication, the patient states the ascorbic acid gives him diarrhea and requests not to take it. Right-click on the medication and choose Mark, then choose Undo Given. The VDL automatically refreshes itself and the space in the status column of the selected order is now blank. After refreshing the VDL, the last action column will then reflect the previous entry. The medication will display on the missed medication report. The medication administration history will be cleared of the activity as well. Marking a medication as held. Select an order. In this demonstration, we will use digoxin. Right-click on the medication and choose Held. A Select a Reason list appears for the user to choose a reason for the medication to be held. When a reason is selected, such as heart rate out of range, click the OK button. An H in the status column now indicates the medication was held. When the screen is refreshed, the last action column displays held and the date and time. Marking a medication as refused. To mark the medication as refused, select a medication. In this example, the ascorbic acid that was previously marked as Undo Given now needs to be documented as refused. Right-click and then choose Mark, followed by clicking Refused. The medication log window will appear and a list of reasons why a medication might be refused is shown. Select an appropriate reason and then click OK. An R in the status field indicates refused in the status column. This information is also recorded in the medication administration log. Note, multiple medications can be marked as held or refused by highlighting multiple medications on the VDL, then right-clicking on one of the highlighted medications and choosing Mark and Held or Mark and Refused from the Select a Reason list. An example of this situation could be a patient who is NPO for a procedure and all of his PO medications are being held for that reason. To highlight specific multiple medications that may not be adjacent to one another, click one medication to highlight it, hold down the Control key, and click the additional desired medications. Right-click on any of the highlighted medications and mark as held or refused as indicated. Entering a missing dose request. The missing dose option is available when a medication on the VDL has not been marked as given. In this example, albuterol is selected. Right-click on the medication. Select Missing Dose. You can also click the Missing Dose button at the top left of the VDL above the patient's name after you have highlighted the medication by clicking on it. The Missing Dose Request window appears. The patient name, ward location, ordered drug, order number, dosage, and administration time fields are automatically displayed. The remaining fields, date at time needed, and reason must be completed as all fields on this screen are required. Type an N for now to indicate the medication is needed now. You may also enter a date and time in the following format: 03/28/12 at 1600, for example, if the medication is needed at a later time. This might be the case when the last bit of ointment from a tube was used for the current administration time, but a new tube will be needed later. Tab over or click to the Reason field. Notice the Date at Time Needed field has an actual date time entered. The Reason field entry is selected from a drop-down list of predefined reasons. Select a reason from the drop-down list. For this example, Not Available is selected. Then click the Submit button. The missing dose request is sent to the specified printer in pharmacy and specified mail group. This will provide an alert to pharmacy so that the medication can be delivered to the user in a timely manner for administration. A display window appears to confirm the missing dose has been submitted. Click OK to acknowledge the message. You are then returned to the VDL.
Notice that the order status column now displays an M to indicate a missing dose request has been submitted. When the medication is delivered, it may be scanned by the user to administer to the patient. The M in the status field will change to a G once it has been scanned. Scanning of PRN medication. As noted previously, the PRN box in the schedule types upper right corner of the VDL must be checked to display PRN meds. To begin, scan a PRN medication. Once the medication is scanned, the PRN medication log window opens. In the lower left corner of that window is the schedule showing how often this particular PRN medication has been ordered to be given. Directly below that, in red, BCMA has calculated how long in days, hours, and minutes it has been since the last dose was administered and the actual date and time. The user must check the box acknowledging they have reviewed the schedule and the last administration time of this medication. This PRN medication log window displays the dispensed drug and special instructions of the order. The last 4 actions recorded will appear, showing the date and time administered, action taken, schedule type, the PRN reason, and the units given. Units given will not display for orders with multiple dispensed drugs. The last 4 vital sign entries are displayed, including the type of vital sign, the value recorded, and the date and time of the vital sign. If a plus sign precedes the vital type, this indicates more than one set of data are available. The PRN medication log window also contains a select reason list, lower right corner, for the user to select the appropriate reason for giving the PRN medication. The list of reasons in this section is site-specific and can be modified by notifying your BCMA coordinator. If you select a PRN reason related to pain, a pain score is also required. The pain score is selected from the list just below Select a Reason. After selecting the PRN reason and the pain score if required, click on the OK button to exit the PRN MedLog window. The multiple dose box appears on orders for which more than one unit may need to be scanned. As you see in this example, the total dose of acetaminophen to be given is 650 milligrams. 2 325 milligram tabs are separately packaged, barcoded, and available for scanning. The check mark indicates that one tab has been scanned, but the second tab has not. If you choose to administer only one tab of the 2 tabs ordered, you can click the Done button. This will cause an alert screen to be displayed as shown. Clicking OK will allow you to continue without scanning the second tablet. The medication log will indicate that only one tablet was administered to the patient. Clicking back allows you to go back and scan the second tablet to record that both tablets were administered to the patient. Once both tablets are scanned, the acetaminophen tab status column will display the letter G to indicate the medication is marked as given. Be aware that for PRN meds, when the screen is refreshed, the G disappears and the medication could potentially be given again. Also notice the BCMA clinical reminders in the lower right corner of the screen. The count has now changed from 0 to 1. This indicates that there is one PRN medication given for which the effectiveness needs to be documented. The use of clinical reminders section to document PRN effectiveness will be described later in this module. Refreshing the do list. After scanning a medication or marking one as held, refused, or missing dose, the status column will display the action immediately. However, note that the VDL does not automatically refresh the information in the last action column. This still displays data from the previous actions taken, such as the administration of acetaminophen. Click on the do list on the menu bar at the top of the screen, then click the refresh option. Note that the Windows standard keyboard shortcut F5 may also be used to refresh the VDL. This option is used to ensure that no new orders which have been verified and ready for administration before moving to the next patient. Also, if a medication order has been discontinued after the VDL was opened, the order will be removed from the screen. Refreshing the VDL reloads all current orders for the selected patient.
Any medications marked given, held, refused, removed, or missing prior to refreshing the screen will now display as a last action. Handling special situations. The following sections demonstrate several important special situations. Multiple orders of the same medication. Occasionally, a patient may have more than one order for the same medication. An example might be diazepam 2 mg TID and diazepam 2 mg Q4-hour PRN for agitation. In this example, after scanning the diazepam 2 mg tablet, the multiple orders for scan drug window displays each of the two orders. From this list of two, select the correct order to be administered and click OK. Multiple administration times for the same order. In some cases, you may see more than one order for the same medication on the VDL, either because the medication is due multiple times during the range of time shown on the VDL parameters, or because the drug may have different administration schedules. A medication such as artificial tears due every hour will appear 3 times on the VDL for any given 2-hour window, for example 1 p.m., 2 p.m., and 3 p.m., when the VDL parameters are set for 1 to 3 p.m. If you scan the medication when more than one order for the same medication appears on the VDL, BCMA will display the multiple orders for scan drug window. You will need to carefully review all orders that appear in that window and indicate which one you are giving by clicking that order on the screen. You can then click OK to continue documenting the administration. Documenting the administration of early or late medications. When a medication is given too soon before or late after the administration time for that medication, a medlog window will display. You will see a message in this window that alerts you that the administration is so many minutes before or after the scheduled administration time. In this example, both time range parameters are set at 60 minutes, so the user has 60 minutes before and 60 minutes after the scheduled administration time to document the medication. Since we are so many minutes after the scheduled administration time, BCMA requires that the user enter a comment to justify the time discrepancy. After entering the appropriate comment, such as patient off unit as our example, the user would then click OK. Multi-dose containers. Medications that are dispensed in multi-dose containers, such as vials, inhalers, tubes, or ointments, require special handling in BCMA. When a barcode on one of these medications is scanned, a dialog window will display to enter the quantity in units, for example 30 ml. Type in free text to indicate the amount of the medication being administered. BCMA requires a unit of measurement such as ml or units with any numeric entry. The user may also enter words such as sparingly or thin layer for topical creams and ointments. When the user does not enter a unit of measurement for numeric entries, an alert window will display as shown here. The use of the abbreviations lowercase u or uppercase u are not acceptable. The user will see an alert window as shown in this example and will be required to enter units instead. Choosing the injection site. In this example, we will use insulin to demonstrate the injection site functions of BCMA. On the VDL, the last column on the right side of the screen displays the last site information from injectable medications. Before scanning an injectable medication, the user may perform a right-click on the medication and select Injection Site History. The window that displays next has two sections. The top section displays the last 4 sites in which this specific medication has been given. The bottom section displays all injection sites within the last 72 hours for all injectable medications that have been given. This may help the user to select an appropriate site to administer the current medication. Clicking OK closes this window. After scanning the vial and entering the units to be administered, the next window that displays is the injection site window. The user must select the injection site from the list available. After choosing the injection site, click OK to complete the administration. Patch medications. The first time a new order is placed for a patch medication, the barcode on the package may be scanned and marked as given just like any other unit dose medication. In fact, a patch that's been given will remain on the VDL regardless of how the VDL time parameters and/or schedule type choices are set. The patch medication will continue to display on the VDL with a status of given until it is marked as removed. The rationale for this is that a patch medication is continually administering the medication while it is on the patient. It is highly recommended that, after applying the patch, you use the right-click and add comment function to enter the anatomic location where the patch was applied. This is not a required step, but is considered a best practice for documentation. The process for marking a medication patch as removed will be covered in the next section. Patch removal. The next medication patch cannot be given until the previous patch for the same order is removed. The previous patch must be removed from the patient prior to applying a new patch to prevent medication overdosing. When scanning a subsequent patch of the same medication, the user is prompted with the following message: "Could not validate this order. Previous patch has not been removed. Do not give." To remove a patch, in this case nicotine, right-click on the patch order. An option menu appears. Hover the cursor over the Mark drop-down box. Because this patch is marked as given, the only available options are undo and removed. In this case, select removed to remove the patch. Back on the VDL, the patch's status column now reads RM, indicating the patch has successfully been removed. When you have marked the previous patch as removed and you have physically removed the old patch from the patient, you may proceed with scanning the next one. Scanning an on-call or one-time medication. Remember that the on-call or one-time schedule type must be checked in order for the medication to display on the VDL. Medications that are not visible on the VDL are not available to be scanned and administered. One-time medications are exactly that. They are medications to be administered one time, such as a seasonal influenza vaccine. One-time medications will display on the VDL until they are scanned and given or until the order expires. If the user has a question about whether or not the medication was given, check the medication log or the expired medication on the cover sheet. To begin, scan the on-call or one-time medication like any other medication. Once all information has been entered, the status column will display a G for given. PRN effectiveness documentation. Each local facility may have its own policy regarding the length of time after a PRN medication is given that the effectiveness is to be documented. The BCMA Clinical Reminders area at the bottom right of the VDL keeps a real-time total of how many PRN medications have been administered without PRN effectiveness documentation. The count field indicates there are X number PRN medications that still require effectiveness documentation. To view summary information on the administered medications, hover the mouse pointer over the PRN effectiveness. An overlay window will appear displaying only the last 4 PRN medications administered that still require PRN effectiveness documentation. This example shows the patient has twice been administered acetaminophen without corresponding PRN effectiveness documentation. The window displays date and time of the administration, the medication, PRN reason, and the name of the medication administrator. Double-clicking on PRN effectiveness opens the PRN effectiveness log window. The patient's recent vital signs are shown along with a list of all PRN medications administered that still have not had effectiveness documented. To chart the effectiveness of the medication, first select the administration from the PRN list. In the Enter a PRN Effectiveness Comment text field, type a free text comment. If a PRN was administered for a medication that requires a pain score, select the pain score from the corresponding drop-down list. The Date/Time field to the right of the pain score can be edited to show the actual time that you reassess the patient's pain, for example, T at 1300. The pain score information will cross over to the Vitals package to document the score for that exact time. After entering comments and selecting a pain score, click OK. Comments are not required when entering a pain score, but are optional. For all other PRNs, a comment is required. The administration is now documented for PRN effectiveness and disappears from the PRN list. You may clear each of the PRN entries from the PRN list in this fashion. Scanning a wrong medication and invalid medication lookup. An incorrect medication may be something as subtle as a different dosage or formulation of the same medication, such as the difference between a regular multivitamin and a prenatal multivitamin. The BCMA software prevents medication errors by alerting users when a medication not due for the patient or a medication that has already been given is scanned. When such an event occurs, an alert message like the one shown here will appear. The message states, "Scan drug not found in virtual due list," or it has already been given. To proceed, acknowledge the warning by clicking OK, and the error window disappears. You will need to investigate why the medication did not successfully scan. In some cases, after scanning a barcode, the user may see an error message that states, "Invalid medication lookup, do not give." When this occurs, notify your pharmacy and follow your local policy for handling medications that do not scan. Missed medications. After completing a medication pass, the missed medications report may be displayed and printed. The missed medications report displays all medications due during a specified time parameter but not yet administered. This report is very valuable to staff who are administering medications to multiple patients and helps prevent errors of omission. To access this report, click the Reports menu and select Missed Medications Report. This brings up the Patient Missed Medications window. The user can select the start and stop time from the drop-down boxes. If the user accepts the default time, all medications that are not yet due will display on the report. Setting stop time to the current time will eliminate future med doses from showing. This report defaults to display medications that have an order status of active, discontinued, or expired, an admin status of missing dose, held, or refused, and it includes detail of comments or reasons. This allows the user to clearly distinguish medications that have been missed for a valid reason from those that have just been missed. Only the active and missing dose boxes are mandatory. All others may be deselected by the user if needed. This report can be viewed and/or printed for a single patient, selected patients, or an entire ward. If the report for the entire unit is printed, the option to sort the print job alphabetically by patient name or by room and bed assignment are available. In this example, the report is displayed only for the patient. To display the report, click Preview. Click Print to bring up the printer selection window. After the printer is selected, click OK to print the report. Edit Medlog. The Edit Medlog menu option allows you to change certain fields, including administration status, the action date and time, the injection site, units given, and units of a medication upon which you have taken action. This example demonstrates how to change a diazepam that has a status of given to the status of refused. From the patient's VDL, click on the File menu and select the Edit Medlog menu option. The Edit Medlog Administration Selection window appears. This window lists the medication upon which actions have been taken today for the selected patient. Only the user who initially took action on the medication may edit the medlog for a particular medication. Select the Diazepam tab entry and click OK. From the Edit Medlog window, the admin status of the medication can be changed. Click the drop-down arrow and select Refused. A comment clarifying the reason for the use of the Edit Medlog option is required, so a short comment is entered into the text field. The units given and units fields may be edited by right-clicking on that field, selecting Edit, then entering the correct information. Finish by clicking OK to close the Edit Medlog window. Then click Cancel to close the list of medications. Changing patients, the Active Orders tab warning. To change the record to another patient, click the File menu and select the Open Patient Record option. If the IV Push, IV Piggyback tab contains active medications and you have not yet viewed them, an alert window appears warning you about the active medications. You are prompted to either click Yes to close the record or click No to remain in the current record and view the IV Push, IV Piggyback tab. In this instance, click Yes to exit the patient's record. The Scan Patient's Wristband window will appear in anticipation of scanning the next patient. Scan the next patient's wristband and the patient confirmation screen appears. Click Yes to acknowledge you have accessed the correct patient record and the screen opens to the patient's VDL. In Module 1, we presented an introduction to the BCMA program and some of its features. We also provided an overview of the Cover Sheet tab in BCMA. In Module 2, we presented detailed information related to medication administration using the Unit Dose tab. In this module, we will present specific information related to the IV Push, IV Piggyback, and IV tabs. When a patient record opens, the Barcode Medication Administration screen always defaults to the Unit Dose tab on the Virtual Do list. At the bottom of the screen, click on the IV Push, IV Piggyback tab. Notice the green circle on the tab indicating that there are active medications here. The VDL on the IV Push, IV Piggyback tab is very similar to the Unit Dose tab. The user may adjust the VDL parameters for time ranges and also select or deselect any of the schedule types. Most of the columns are the same as on the Unit Dose tab. For IV Piggyback medications, the Medications Solutions column, which replaces the Active Medications column, will display the dosage of the medication and the volume of the IV solution in which it is prepared. Another difference between Unit Dose and IV Push, IV Piggyback tabs is the Infusion Rate column has replaced the Dosage column. This column will display the actual dosage to be administered for all IV Push medications, such as 40 milligrams per 2 ml. For IV Piggyback medications, the length of the infusion time is displayed, such as infuse over 30 minutes. This column also displays the frequency of the order, such as QID. Scanning an IV Push or IV Piggyback medication. Notice that there are only 2 medication orders listed on this IV Push, IV Piggyback tab. When an IV Piggyback medication is prepared and delivered by pharmacy, each bag contains a specific, unique IV barcode label. Each label printed for this order will have a different number. After scanning the barcode of the IV Piggyback medication, the injection site needed window will display. To select the correct injection site, scroll through the list and click on the appropriate IV site. Click OK to complete the administration and return to the VDL. Note that a G now appears in the status column indicating the medication has been given. IV tab VDL display. Change the view to the IV orders by selecting the IV tab. Notice the green circle on the tab indicating that there are IV fluids ordered. Continuous infusions are displayed on this tab. Notice also the significant difference in the layout of this tab compared to the unit dose and IV push, IV piggyback tabs. Since IV orders do not have scheduled administration times, the virtual do list parameters and schedule types are both grayed out. This tab can be divided into three separate sections: IV orders, IV bag chronology, and IV bag detail. IV orders. The top part of the VDL displays the IV orders. Notice the status column on the IV orders. This column only displays the status of the medication order, such as active, discontinued, or expired. To display further information about a particular IV, you must click on that IV order. This will be demonstrated later in this module. The next column displays the Verify column to indicate the initials of the nurse who verified the order in CPRS. 3 asterisks indicate that the order has not been verified by the nurse. The next column displays the type of IV order, such as admixture, chemotherapy, hyperal, or syringe. The next column displays the medication or solution information, similar to the IV push, IV piggyback tab. The infusion rate column displays the IV rate as ordered by the provider, such as 75 mL per hour or titrate. The @ sign indicates the number of bags of this IV that pharmacy prepares and delivers every 24 hours. An @0 will indicate the IV fluid is available as ward stock and will not have patient-specific labeling from pharmacy. The route column displays the route, usually intravenous. The bag information column displays the information for the last action taken on an IV bag. If this space is blank, no IV fluids have been scanned in BCMA for this order. IV bag chronology. Clicking on an order in the top section will display more detailed information in the IV bag chronology window, which is in the lower left of the VDL. This section will chronologically display the status of individual IV bags for that particular order, such as infusing, stopped, completed, or available. Double-clicking on a date in the IV bag chronology section will either expand or collapse the IV bag information for that date. For each IV bag, there will be a plus sign to the left of the IV bag number. Clicking on this will expand the information to display basic information about the IV bag contents, but not actual volumes or dosage of medications. In the IV bag chronology section, there may be 3 types of display icons: a small blue IV bag for available, a small blue IV bag with an up arrow for infusing, or a green check mark meaning completed. IV bag detail. If you click on a specific bag number in the IV bag chronology window, information will display in the lower right side of the VDL. This is the IV bag detail, where you can view further information on that particular IV bag, such as the date and time the IV was hung, the initials of the nurse who hung the bag, action taken such as infusing, stopped, or completed, and comments that may have been added by either the original nurse or others. For bags that display as available in the IV bag chronology, no information will display in the IV bag detail section. As this presentation continues, examples of each display status will be shown. As noted in Module 1, columns and sections may be resized to view information better. Scanning a ward stock IV bag. To start an IV bag infusing, scan the IV barcode. In this example, the IV scanned is a 1,000 milliliter bag of lactated ringers. Lactated ringers is a ward stock admixture. The ward stock window appears and lists the scanned item. Click OK to proceed. Next, the injection site needed window appears. This window displays a selection list of acceptable injection sites. In this example, the injection site intravenous peripheral is selected and accepted by clicking OK. Notice that the IV chronology window now shows the infusing bag of lactated ringers. When the barcode of a ward stock item is scanned, a unique internal entry number, or IEN, is generated for that bag. The IEN generated for this example is 286717WS4. The WS in the IEN identifies this bag as a ward stock item. If additional medications are mixed into the IV solution by the nursing staff at the point of care, it is necessary to scan each additive. In this demonstration, a multivitamin will be used. After scanning the ward stock IV fluid and before clicking on OK in the ward stock window, scan the barcode of the medication to be added, such as the multivitamin. You may be prompted to enter the quantity and units of the medication being added to the IV fluid. If any of the medications scanned do not match the medication in the IV order, you will be prompted with a message window to alert you of this discrepancy. When all of the additive medications have been scanned, click on Done to complete the administration. Notice that a new bag with a unique IEN now displays in the IV bag chronology section. Scanning a pharmacy-prepared IV bag. A unique IV admixture sent to the unit by pharmacy for a specific patient will have a V in place of the WS in the IEN. This number is generated when the pharmacy prints the unique label for the IV. For these IV fluids, you must scan the barcode on the pharmacy-applied IV label, not the manufacturer barcode on the bag. Complete the scanning and administration process as noted previously. Scanning a new bag, completing a currently infusing bag. When hanging a new IV bag on an order that already has IV fluids infusing, the process is slightly different. To begin this process, first scan the new IV bag. The ward stock window appears, displaying the scanned bag. Click OK to acknowledge the scanned item. An alert window appears, requesting confirmation to complete the bag that is currently infusing. Click Yes to confirm, and the Scan IV action window appears. The option Completed is already selected as an action. Simply click OK to complete the previous bag. Next, select the site for the new bag from the selection list of injection sites and click OK. Now the IV bag chronology section shows the completed bag and the new infusing bag. No bag available. In the IV tab, clicking on an IV order in the top section of the VDL will display the IV bag chronology section. For a selected date, you may see that there are available bags with a unique bag number. If you are unable to locate any of these available bags in your medication room or medication refrigerator, you may highlight one of the bag numbers, right-click, then select Missing Dose. Fill in the date and the time needed, or type in N for now. Then select the option Not Available. This will send an alert to pharmacy to prepare and deliver the IV bag. If you select an IV order in the top section of the VDL and no available bags display in the IV bag chronology section, you may scan a ward stock bag that matches the active IV order on the VDL to begin a new bag for that order. If there are no available bags in the IV bag chronology and the IV order is not a ward stock IV fluid, follow your local policy for obtaining the IV fluids. This may include calling the pharmacy to notify them that no bags are available to administer. You cannot enter a missing dose request to pharmacy via BCMA if there are no available bags displaying. Also note that you cannot perform a missing dose or any other action on an IV order that has not been nurse verified in CPRS. Stopping a bag. Occasionally, an IV may need to be stopped and restarted later. For example, such an event may occur when a patient has to leave the unit for a procedure and bringing along the IV would be inadvisable. Only use the stop action if you intend to restart the IV bag infusing. To take action on an infusing IV, from the IV bag chronology window, right-click on the infusing bag. A menu of available options displays. Select the option Take Action on Bag and the Scan IV window appears. To proceed with the stop action, click on the arrow in the Select an Action box. Select the Stopped action and click OK. An alert window appears warning that a comment was not entered. When an IV is stopped, a comment explaining the reason for that action must be entered. Click OK to acknowledge the alert. Enter an appropriate comment and click OK to complete the process as shown here. To restart the bag infusing, right-click the stopped bag. From the Select an Action box, choose Infusing and click OK. A comment is not required when starting, or in this case, restarting an IV infusing. Completing a bag. To complete the last IV bag of an order, in the IV bag chronology window, right-click on the infusing bag. Select the Take Action on Bag and the Scan IV window appears. To proceed, click on the arrow in the Select an Action box, select Completed, and click OK to complete the last bag. The IV bag chronology window now indicates the IV bag is completed. Although this method is typically used to complete the last infusing bag for an order, it can also be used to complete any infusing bag. Entering a comment. You can enter a comment for any infusing, stopped, or completed IV. Reasons for entering a comment may include rate changes for an infusing bag or the amount of a completed bag that actually infused. In this case, we will indicate with a comment that 500 cc's of the completed bag actually infused. To enter a comment, right-click on the bag and choose Add Comment. Enter your text comment in the Add Comment window and click OK. Notice the IV bag detail window. Each action that was taken is listed with the most recent action at the top of the list. In this example, the last action taken was the comment that was entered on the completed bag. This concludes the BCMA web-based training for clinical staff and users. Thank you for your participation.